And welcome to everyone for joining us today. We're going to be talking about trauma-ready schools and trauma-ready certification. I'm also going to be speaking about something called Alyssa's Law. Alyssa's Law is a law that it's kind of a templated law that's actually being replicated in many states across the United States. Even if you don't have Alyssa's Law, you can imagine that there are conversations like this coming to a state house near you. So that's me. I do chair the Center for College and Career Readiness. I am the author of Whole, What Teachers Need to Help Students Thrive. And our course, which is called Trauma Readiness Certification. It's actually a graduate level course, and it is offered in partnership with the University of Southern California Rossier School of Education. Our agenda today, I want to talk about what trauma readiness is. I will be speaking about school violence and school shootings, but I'm going to expand significantly beyond that idea. We'll look at some data from the FBI, Homeland Security, and some FEMA statistics on school violence. We'll talk for a little bit about the kinds of laws that folks are looking at and an analysis of what we see there and what we know about what it means to alert inside of a school or a district, and with some recommendations. So to begin, I like to begin with reflection, or what I think of as imagination for innovation. So consider for yourself, do you currently have a trauma readiness plan? In your school, in your district, with your leadership team, have you created a plan and really gotten it out so that the level of action is at the classroom level? You can feel free to chat it up in the chat box. My colleague Ruth Bross, Kim Bolser, they'll be having conversation with you in the chat box as well. Do you currently have a trauma readiness plan? Because for many districts, they might have a plan around a code red. They might have a plan around a school shooter or active shooter incident. As a matter of fact, they might have a plan around a medical emergency. But for most schools and districts today, they have not considered an expansive view of what trauma is and what trauma means. So I'm going to give you a few items to consider. First of all, bullying or student-on-student incidents. As a matter of fact, most of the items that might cause a request to a school resource officer tend to be these types of incidents on a regular basis. A medical emergency, that could be student medical emergency or staff medical emergency. And right now today, if your schools, even if you're not going back to school right away, this is something you should be thinking about. If you look at the data on what happens with respiratory issues and attacks in a COVID environment, COVID era, right? Sudden death, the death of a student or staff, and what happens as the faculty and the student body are coming back to school. A catastrophic event, that could be a natural event like a hurricane. I'm sitting in Florida right now. We have our first tropical storm of the season on its way, or it could be random. It could be something like a fire, or a catastrophic event that is an event of violence. You also have the idea of latent trauma. That's literally trauma that students or staff are bringing back into the school. Right now, every single school in America needs to understand that latent trauma is going to be walking into the doors because that is trauma that's happened during COVID times. And that could be everything, by the way, from a student that had, maybe they were hungry, or maybe there was a lot of fighting in their home, or a staff person who's been struggling with everything from finances and budget to maybe their marriage was dissolving, or a student or staff person that lost a loved one or a friend. And then lastly, there's the idea of secondary trauma. Secondary trauma is something that we studied extensively in our book, Whole, because it's what you might call the caregiver's dilemma. One of the things that we know about both students and staff is that if we have traumatic events happening around us, or we are caregivers, we're exposed to it, we actually bring that trauma into other parts of our lives. And it makes its way into disciplinary issues, depression issues. And by the way, those things can become triggers for other elements like bullying or a medical emergency, someone trying to take their own life, or even trying to take someone else's life. So that's an expansive view of trauma readiness. That's what I'm talking about. And if we think about how we become ready and plan for and activate against these kinds of issues, there's an index that we can look at, and it has 3 parts: an awareness scale, the skill scale, and the readiness scale. And when we were building our graduate program around these items, we actually built a journey going from, for instance, in awareness, being generally aware. That's something that happens kind of in professional development. Like today, you're going to be generally aware of some things, to really becoming an expert about what to look at, what to look for. I really am aware of the kinds of things that are likely walking into my classroom today. Deep awareness, and not just reaching the level of administration or counselors, but to that classroom level to become trauma aware. On the skill scale, you have the idea from novice to fluency. So the idea behind a novice might even be someone who can literally, if you think about physical kinds of things, has kind of a general awareness of how to do CPR, or who could take the defib out of the box, right, and know to do something with it, but they're not really fluent. On skills, when you think about what's happening with trauma, I have to drill to a place where I am fluent and I know exactly what to do, not only as a response, but also as a preventative measure. We can even think about that as de-escalation inside of an event, to be trauma skilled at the level, again, of the classroom. And lastly, you have the readiness scale, and that goes from being strategic to really being operational. Lots of districts have plans for lots of things, but many of them don't actually operationalize those plans. And that's why they're caught kind of slow-footed when something really happens. An operational plan to be trauma ready actually has to be tested at the level of classroom tactics, and include, by the way, if you're thinking about, for instance, a school shooter or some kind of school violence, actually be tested with your first responders. There's a really interesting set of research around that. The number of times that first responders have come in for those kinds of tests and had an issue where, for instance, a school resource officer or a school police officer ended up in the drill being attacked because they had a gun and they didn't understand what was really going on. So readiness scale, getting to trauma ready, operational fluency at the classroom level. So our next question for all of us is, do we have a systemic method of identifying underlying trauma as a part of prevention? So we're beginning with awareness here, starting with trauma awareness. Do we understand what the factors are we need to look for? Do we know the methods of identification? Are we actually reporting out? And do we have codified reporting practices that we make a part of our general operational routine in our classrooms, in our school buildings, in our district? And are we looking at immediate interventions? Let's go a little bit deeper into trauma awareness. Now, I'm going to think for a moment about that issue of the school shooter or school violence. The FBI has a variety of resources. And by the way, there's a link. We'll get you some materials, all of the research that I'm talking about here, including some of the materials from the FBI and FEMA. But essentially, the FBI says we need to look at some precipitating stressors. These are incidents, circumstances, things that happen that literally start an emotional chain reaction. If you are looking for those things, you can actually head them off at the pass. Did you know the vast majority of counseling that students receive, mental health treatment that students receive, they actually receive inside of schools, even though we don't report it that way? Also, we need to be looking at and aware of some of the predisposition factors. These can be personality traits and characteristics, temperament for our students, to make us aware. And I'm not just talking about make us aware early on of someone who might be a potential school shooter or a bully or carrying out acts of violence, but also someone who might harm themselves at school. Awareness is the kind of codified operational skill of getting ready and taking early action. The FBI actually has developed a 4-pronged assessment model looking at school shooters. the personality of the student, family dynamics, school dynamics, and the student's role if the student is an outlier, and social dynamics. As a matter of fact, if you've been in any of my courses before, any of my webinars, you know that I don't feel right talking about challenges and not giving out some things that would help you. So one of the things that you can actually access as a part of the presentation today is our partners at Meteor Education. They'll actually help you to evaluate something called the pro-social learning environment. There's a whole set of research on something called the pro-social environment. And these are learning environments, classrooms that are specifically designed to help you make sure that students are included, and also to evaluate if there are students on the outskirts that might be having some of those issues. I was at a school outside of Dallas. It was an academy specifically built for boys. And frankly, most of those boys were Latino boys or African-American boys, and they'd all been in trouble. And it was specifically built to make sure that they came in, that they were included, and they were building their confidence to become very successful in school, highly effective. And my friends at Meteor helped to build that environment. So I'll talk a little bit more about that, but you want to assess actually the environment. Is your environment helping you become aware of some of the challenges? Another part of awareness is understanding that there's something called an adverse childhood experience. And if you look at what's actually happened in the United States over time, it isn't just that we have more poor kids or we have kids coming from a variety of diverse cultures or diverse families, but we actually have a lot more children who've had ACEs, adverse childhood experiences. And I'm going to put in the materials and a kind of assessment that you can use if you want to get at understanding which of your students have had an ACE. In the United States, in an average class of 28 students, 6 of those students would have had 2 or more ACEs. 3 students would have ongoing weekly trauma of some sort, and on average, in that average classroom of 28 kids, 14 students would have experienced trauma inside of their childhood that stuck with them. That could be everything from some kind of abuse, that could be emotional, physical, sexual, to some kind of trauma related to poverty. They had experienced hunger, but they carry that baggage into the classroom with them. And it stands between them and learning. It stands between them and success. And by the way, it's one of those sets of triggering kinds of experience that can lead to more trauma that affects the entire school. And by the way, the data I just took you through, you can double those data points if you look at struggling learners. So that if you look at a class, for instance, if you do RTI, Tier 3 intervention, almost every single student in a Tier 3 intervention has had an ACE. One of the ways that we could think about, how do I become aware on a regular basis? How do I actually measure social emotional engagement status? Is through the following kind of clinical assessment. As a matter of fact, you can do this assessment with a little piece of software called Rhithm, and you can start for free. And my friends, Kim and Ruth, they could actually get you hooked up at no cost here this fall. But even if you didn't use software, you can use this kind of emoji assessment. It's actually been developed by clinicians. What is it like in your head today? Now, that actual indicator usually is synthetic. It's a symptom. It can be a symptom of lots of different things. But for instance, a more critical question is, how does your body feel? Is it sick? Are you injured? Are you hungry? And if you think about how we prepare for trauma readiness, I need to make sure that I have a culture in my school where it's okay to talk about being sick. It's okay to talk about being injured. I have someone I can talk to about being hungry, because these are areas of stigma. And right now, as I speak to you, there is a growing set of conversation around COVID stigma. People are afraid to say that they had someone sick inside of their home because they're afraid that people will look at them funny. You know what I'm talking about. They're going to be afraid that, you're going to look at them and say, oh my gosh, he's going to give it to me. Sick, injured, and hungry. How's my social life going? This is another essential area to evaluate. Disagreement, conflict. That could mean that I'm being bullied. It could mean that something's happening at home. And then lastly, how do I feel today? Am I sad? Am I angry? These are elements that I want to get a sense of in real time. It's actually why I'm a real advocate for what Rhithm is doing. And by the way, I might not just ask these kinds of questions at the beginning of a class, or if you're doing online classes at the beginning of the day, but I might do it after lunch. I might do it at the end of the day to get a sense of how my students are doing in real time so that I can respond. What I'm showing you now is actually a report that Rhithm built for the state of Alabama. And they can actually look into zip codes where they have high risk alerts or high hunger. And I've been suggesting to every administrator, this is something our schools should be looking at right now. Which of our students are coming into the online environment or the in-class environment with these kinds of challenges? But you know, it's not just our kids. If you're an administrator, I want you to think about the usefulness of this kind of information for teachers. As a matter of fact, there's a district in New Mexico right now that they're launching Rhithm, both as the way that they take attendance at the beginning of the day, the middle of the day, and the end of the day for all their students, but they're also using it with their faculty. Because our teachers are also going through a lot of stress. Right now, imagine if you're going to be a teacher and you're going to be teaching from home and you have kids at home. I honestly cannot even imagine that. But if you look down here, I have a question. Which of the bullets, orange or blue, do you think is a teacher, and which one do you think is a student? Because not all of the indicators would go as you might expect. As a matter of fact, if you look at the emotional indicators, if you look here, I actually have more happy students, that's the blue, than I have happy teachers. My teachers have a significantly higher level of anxiety, this is real data, than my students. And as a leader, I need to do something about that. This is a place where I want to have conversation with my staff. One of the things that we found when we were doing the research for the book Whole is that schools that were really outperforming the socioeconomics of the neighborhoods around the school, they were succeeding because they were attending to the social emotional needs of their teachers first, so that their teachers, who are really on the front lines, could attend to the social emotional needs of their students. So when we think about trauma awareness, just to sum that part up, I want to think first of all about awareness of lots of things. I'm not just talking about violence. I want to think about really internalizing what I'm looking for, knowing what I'm looking for, and I'm actually considering how I can intervene early, how I can counsel early. I'm looking for things like predisposition and other indicators of an adverse childhood experience. And if you're lucky, you actually have a tool like Rhithm that lets you measure that in real time so that you can intervene. And sometimes the intervention is as much as making sure that a student is getting food or a student is having a conversation with a caring adult. But from awareness, it's not enough to be aware. And by the way, I just want to say you don't become aware just through one PD. That's why we built an entire graduate course around awareness, skills, and readiness. Trauma skilled means that I know something, but I can take continuous action. I'm always doing it, all right? I'm always understanding the look-fors. I have the ability to immediately act. I have a kind of muscle memory. What happens urgently can be baked into my routine. This is actually what the military does. That I've created a culture of caring where I can have conversations about being hurt, about being bullied, about being abused at home, about being hungry, about having someone, someone had COVID, compassion and concern. And by the way, that's also true for my staff. Stress awareness, and I become a de-escalation expert. When it comes to being skilled in this area, my colleagues at the Successful Practices Network, they've done a lot of work here, and they're really informing what we're doing in our course with USC. They talk about first really building support for critical needs, right? Building resilience. Connection is an actual skill. Caring adult relationships. And here's the way I put this. If you're a teacher or you're an administrator and you're doing observations, the student, it's really hard for the teacher to connect with. Actually building that connection, that is a skill. Creating a secure, accepting environment. Talking about things openly. I want you to consider what's been happening with Black Lives Matter, with some of the riots or the demonstrations or the protests in our communities. Having conversations about those things in a secure way, in a safe way, and in a way that's appropriate for context is important. Because you know what? Some of our students were out there protesting, and some of our students are experiencing impact from those protests. So this is actually a strengths-based approach. It's not a blaming approach that fosters success. After I'm building the support for those needs, then I have to think about my skills. Skills are built into the normal operation of the classroom, the normal operation of the school building. For instance, a principal level skill might be a principal every morning standing, watching kids come into the building, touching base with teachers as they're coming into the building as a part of that conversation, all right? Responding to concerns with de-escalation and knowing immediately how to de-escalate and the best ways to do that. Skills to return a classroom and a school to normal operation once something has happened. And by the way, in COVID times, that might be someone has been diagnosed as being COVID positive. Because you know what, there's all of a sudden a lot of fear in that classroom with that teacher, with other students, having a procedure for that. Systems, processes, and networks for intervention and treatment. Now I'm going to take you through a real life school shooter transcript. This is the idea of immediate response. And again, I'm not just focusing on school shooting, but I want you to consider that skills have to be baked into our autonomic response. They have to become so automatic, and you'll see why. And this is real life, by the way. At 2:19 p.m., my student who's going to cause a problem has arrived at the school. And they were actually viewed by security with a rifle bag. The security radioed a message to a second security staff. They didn't raise an alarm. There was no crisis alert, nothing inside of the school. At 2:21, the student entered the school. They were spotted by a second monitor holding the rifle bag. But the second monitor also didn't raise an alarm, didn't have a crisis alert, didn't take immediate action. Another student encountered the shooter actually loading their gun. They were in a stairwell. And the shooter said to that student, "Things are about to get bad. You better get out of here." That student runs and actually runs into another staff person, a coach, who had a radio. The coach goes toward the building, but right now I have 3 adults in my school and no alarm has been raised. And the student goes in to the first floor and shots were fired. As a matter of fact, the student killed 3 kids that were in the hallway and then started shooting into classrooms. And this is where most of the casualties happen. Now, there's a staff person who hears shots and they actually run up and they run into a second floor closet to hide. Now, you and I might look at that and say, what the heck were you thinking? That's actually what your brain is programmed to do. This is something called the amygdala hijack. They did exactly what their brain was programmed to do. At 2:22 and 13 seconds, there was the first 911 call. Someone heard the shots and called, but it wasn't routed to the nearest responders because of the way the 911 system worked. And then there was an alarm. There was an alert. And it was an alert from the shooter. The shooter pulled the fire alarm. They go up to the second floor. Now on the second floor, someone had said to one of the teachers, "Hey, we think we heard shots." And those teachers were alerted. They went classroom to classroom. They pulled their blinds down. They closed the door and they locked their doors. Unfortunately, there were some students that were locked out. They were in the bathroom. But in this particular scenario, this real life scenario, there were no casualties. The third floor was filled with evacuating students. They didn't know what was going on. They heard the fire alarm. The shooter went to the third floor and it was like a shooting gallery. The sheriff is finally actually on their way after all of the shooting has happened and a code red is initiated. If you look on my screen, at each and every asterisk, there were opportunities where we could have gotten ahead of what was about to happen. But you see, in this case, we did not have skills that were an automatic response, and we didn't have a campus-wide alert. If you knew exactly what to do and you knew what was really going on at the very beginning, we could have prevented most of those casualties. So if you think about moving from awareness to trauma skilled, awareness can begin long before a traumatic event. As a matter of fact, in this case, when they finally found out who the shooter was, it was a surprise to no one. The student had actually been on an FBI watch list, but we hadn't had intervention counseling. There wasn't action that prevented it. Awareness and alerting are different. As a matter of fact, in this case, my actor, my shooter, actually alerted that something was going on. And that alert button, that panic button, became a tragic button because folks didn't know what to do and they took the wrong action. And remember that faculty member that went into and hid. We are designed to shut down during a crisis, to freeze or to flee. If you haven't drilled into your classroom teachers exactly what to do so they actually take action automatically, they will shut down and their brain becomes fuzzy. And that's just human brains. As a matter of fact, this is research from the University of Central Florida Nicholson School of Communication. And they've done a lot of research on what happens in a high stress environment. And stress isn't just a shooter, by the way. Stress could be a medical emergency. Stress could be bullying, right? It could be someone being violent in a different way. Could be a heart attack. In a high stress environment, we actually process fewer than 1/2 the number of normal messages that we would process. Less than 1/2. Normally, we would process about 7 messages. We only process 3. And we process information 4 grade levels below our normal grade level of understanding. That means that whatever we need to understand to do, it has to be simple, it has to be autonomic, and I can't have too many messages going on. This is the actual human experience of trauma. By the way, did you know most school shootings, they don't happen in a building? They happen outside of a building. They happen outside of the classroom. They actually happen in a parking lot. And even those that happen in a building, they don't happen in a classroom, even though classroom is number one, because there are more classroom spaces. Most of them happen in a bathroom or in a cafeteria or a place. And here's why this is important. They don't happen where people have access to a cell phone. They don't happen in a place where I have a phone readily available where I could just call someone or I would know immediately what to do. And sometimes I wouldn't even have coverage for a cell phone. And that's going to become important in a moment. And as a matter of fact, there's usually so much time that what happens is that the shooter actually flees. Now let's go beyond the school shooting because, as I said, there are a lot of different kinds of trauma. So I want you to consider other kinds of traumatic events, because if I just perseverate, if I just focus on school shootings, I can actually obscure some of the things I need to do to become trauma skilled. 10% to 25% of all childhood injuries happen at school. That can be a concussion, that can be a broken arm or leg, allergies, seizures, broken bones, shortness of breath. 65%, 2/3 of school nurses end up managing a life-threatening event annually. Let's just think about that. 2/3 of school nurses have a life-threatening event annually. And 85% of schools actually have a plan, but more than 1/3 of them do not practice that plan. They couldn't tell you what that plan is. And if you have a sub, they don't know what that plan is. They have a new teacher, they don't know what that plan is. This is a challenge. 72% of schools do not have an adequate campus communication plan for when something happens. And I want you to think about that right now today. If right now today, we were going to go back to school and we had a student or a faculty member, and we learned that they were COVID positive, would we know who to tell, how to tell them, and what to do around that? By the way, the following data was from the Journal of Pediatrics. So let's think about your campus, a real life campus. Student has an acute anaphylactic attack. That's an allergy. They're in the bathroom. They could be dead in 15 minutes or less. What they need is an EpiPen plunged into them. They're in building A. They're on the 3rd floor, and then the boys' bathroom. That's one of 2. A student sees their peer having a problem, comes back and reports to their teacher that the student is sick. What is the teacher likely to do? Are they going to know what to do? Are they going to go immediately to the bathroom? Are they going to alert first? When they alert first, are they going to say, hey, I have a student, they appear to be having some kind of seizure, they are in the second boy's bathroom nearest? What are they going to do? Because you see, really complex actions, they're not reliable. I'm not going to be able to think through a big checklist of what to do. Where's the phone? What do I say? Who do I call? Being skilled means knowing exactly what to do and being ready to take immediate action. Remember, that could be for bullying, a student-on-student incident. It could be a medical emergency. It could be finding out about a sudden death. Perhaps, by the way, a student is referring that there is a sudden death, or a staff. Different kinds of catastrophic events. Latent trauma that's coming into the school. And by the way, this is really important. What's my reporting process if I find out, for instance, that a student has had a death in their family or secondary trauma? As we think about how we become ready, truly ready for this kind of event, I want you to consider that there are laws being written that are indicating some things that we need to do. So Alyssa's law is a lot actually started in Florida. Other states are taking, but there are a variety of these kinds of conversations. They're saying, listen, in schools, we are responsible for the health, safety, and welfare, and we have to have some kind of panic button. And that panic button should at least alert 911, all right, for every classroom. All right, great. This, by the way, this is an example of that in one particular law where it said that I have to have a panic button and it has to integrate with local public safety answering points. My friends, this is so inadequate. The idea that by having just a panic button or alert in schools that I'm actually going to do anything, again, I'm going to go back to that real life school shooter incident. There was a panic button, all right. The shooter pulled a panic button and it ended up in a shooting gallery upstairs. So we've actually done an analysis of these kinds of traumatic events. As a matter of fact, we ended up writing a template for RFP for Atlanta Public Schools. And by the way, we'll be happy to share that with you. Here's some things I want you to think about. If you're thinking about alerting, whatever the alert is, it needs to be accessible. The alerting needs to be functional everywhere. It can't just work one place or another place, all right? It cannot be dependent, for instance, on cell phones and cell phone coverage. You don't want to have false alerts. By the way, too many false alerts. It's like the boy that cried wolf or the girl that cried wolf. Now I don't know if I'm supposed to do anything. It can't have too little information. I need to know that there's a problem. It's on the third floor. It's in the second boy's bathroom, and it's a medical problem. Always available, and it needs to support human action. There needs to be some kind of very specific procedure that when I get the alert, I know immediately what to do. It's not enough to say there's a fire if I don't know exactly what I'm supposed to do with that fire. And by the way, I should know, hopefully, where that fire is because I have a couple of exits. So I am a really tremendous critic of folks who believe that our cell phones are going to be the answer. By the way, district going to give everybody a cell phone? Is it maintained by the district? Did I make sure that I plugged it in? I don't know if you're like me, but I have a Mophie on mine because I'm always having challenges with battery. Can I quickly find the app? You have to be aware of what is actual human practice. And it needs to directly support what's happening in my schools for my emergency response. Is this a code red, a code yellow, a code blue? School provided alerting, a dedicated system, and it should be designed to be worn. So even if I'm in the bathroom or I'm in the hallway, I have it with me so I can make that alert and everyone around me knows exactly what's going on and exactly what to do. And we like to say is supported by trauma readiness certification. Now, I would note that if I don't have a pro-social environment, if I haven't actually thought about the kinds of learning environments my kids are in, I likely still am not going to be able to respond appropriately. If I don't have an environment where I've identified my safe corner, if I don't have an environment where I've made sure that the kids that are having problems are actually brought in and I can enact with them, I can interact with them, I can de-escalate, I'm not actually ready for when trauma is happening, because trauma happened long before that student came in. In that instance, was shooting, or trauma was happening before the student actually had their attack. So I want you to think about a trauma readiness index. The awareness scale, moving from general to expert, I have to be aware at the classroom level. At a skill scale, it's moving from novice to fluency. I have to be fluent with an automatic response at the level of the classroom. And a readiness scale is from strategic, I made a plan, to operational. And it's tested, it's drilled with first responders, it's drilled in real life with everyone inside of my building. And that's what it means to be trauma aware, skilled, and ready. So, like I said, I want to make sure that you are supported in actually implementing some of these ideas. My team members here, Ruth and Kim, if you wanted a district-specific planning session via Zoom, by the way, we could actually help you think through, do you have pro-social environments? What kinds of plans do you have in place? Are you drilling appropriately? Hillsborough, Florida is one of the 10 largest school districts in the United States. We actually connect you with their security team and their vendor. I'm not promoting their vendor, but they've gone through a lot of this kind of thinking. Happy to get you that RFP template that we did for Atlanta. Again, another really large urban district. And if you're interested in that software that actually allows you to see into social, emotional readiness, awareness, that status for free, instructs you for free, we can do that as well. The class, Trauma Readiness Certification with the University of Southern California. Actually, right now, we do have support for tuition. So that's kind of on the cheap. And then that on-site environmental assessment with Meteor. So I hope as you're thinking through these things, what it means to be trauma ready, we'll also get you a copy of this presentation with this PowerPoint and the other materials so you can share the message and the learning with your teams. Lastly, I just want to note that as we are in COVID times, a lot of the trauma that might be happening at a distance. And it's one of the reasons why I'm a real fan of asking students how they're doing and understanding what's actually happening in the home. And even as a principal, asking how my teachers are doing, because I don't want something really sad, really traumatic to occur in the home. To be honest, I was just in a conversation, keeping this really real, with some colleagues, and there was a faculty member who recently took their life. So sometimes when we think about suicide, we're thinking about students, but it was actually at the faculty level. I think we have a lot of trauma going on in our faculty ranks. So we're starting the class this fall. And if you have any questions, we can chat it up. And I'll look at the chat box. Hard for me to see the chat box here. Looks like we're saying we're going to get information out. So thank you very much for joining us. I hope to see you in the trauma readiness class. I hope you found the information useful, and we'll get you the links to all of those pieces. And I hope you frankly try Rhithm. They're giving it out for free right now. All right. Thank you so much. Take care. We'll see you at a next Leader to Leader research briefing.